Dr. Stevenson, another great question. Can too much expansion cause recession or move teeth out of the bone?
This is a great question, and I get a lot from our doctors when I've sent them a case to preview and to approve. I will get this question coming back saying, "Hey, I'm really concerned. I don't want the roots of those teeth, being pushed out of the bony trough. So what can I do, or what can we do to prevent that, and so forth." So looking at this, the main things that will cause gingival recession or bone loss on the buccal or facial sides of our teeth are really just basic, and we all know this. It's excessive expansion beyond the norm, number one. That's why we want to stay focused on keeping our expansion within that average range that I previously talked about. So yeah, if we're trying to expand the upper arch or upper intermolar width to be like 45 and 50 millimeters, that definitely is unsafe. So, we will never send you a case like that. Excessive root torque. What I mean by root torque is trying to push the roots facially too far. That applies too much force against the facial or buccal plate of the bone, and that can create some dehiscences or fenestrations that we don't want. Excessive force is something to think about. We really don't have to worry about it with aligner therapy. Our tooth velocities that we have in our protocols keep our forces light. But if you look at cases, well, say for example, you were to use a rapid palatal expander for the upper arch, that has a lot of force in there. And if we're going too much force with those types of expansions, we will get recession or cortical bone loss. Aligner therapy, we really don't have to worry about it because our force levels are low. If we have a tooth or teeth that already have gingival recession, we have to watch that very carefully, so we don't do any further expansion on that particular case if at all possible. We can tip the tooth that has gingival recession and pretty much preserve it, but we don't want to bodily translate that tooth. So if there's any concerns, gingival grafting more than likely should be done prior to aligner therapy just to protect those gingival tissues. And of course, if we have a case where we've already got bone loss or we've already got bone dehiscences or fenestrations, we really do not want to expand those cases. And, last of all is poor oral hygiene. And I think most of us know that any orthodontic treatment that we do with our patients, they need to be impeccable with their oral hygiene. If not, things just go south. So we want to make sure that the hygiene is really optimum in these particular cases.